Warning, the following audio transmission is based on theory and is intended for entertainment purposes only. It's Doomsday and its affiliates will not be held liable for anything your dumbass does. Listener discretion is advised.
Welcome, everybody, to It's Doomsday podcast. We are back with part 2 of our interview with Dr. Alton. So here we go, guys. We're going to jump right into this. Okay, so Dr. Alton, I'd like to kind of get into some of these different scenarios that you cover within these books. And I've got a list of them here. And I don't know if you want to start with the extreme ones or if you want to start with the simple ones and work up. What would you prefer?
Well, what we can talk about, how about bleeding?
Okay, yeah.
Talk about that?
Yeah.
Is that one of the things you want to talk about?
Well, yeah, so that would fall under how to treat gunshots and knife wounds, I would assume. Yep. So let's start. So first off, for anybody out there that doesn't know, bleeding kind of takes priority over everything, right? You're going to want to stop that bleeding. You need blood in your body to survive. So this is probably one of the biggest things that people are going to need to know is how to stop the hemorrhaging, how to stop bleeding. So Dr. Alton, tell me what you know.
All right. Well, this is the basic thing. You need to have some basic materials, and we also design an entire line of quality medical kits over at doomandbloom.net, and you would be very, very well served by having something like that available. Now, the thing is the first thing that you'd like to do, that we'd like you to do, is put on gloves, because of course you can introduce infection or have infection introduced on you. So put on gloves if you got them. If you don't have them, immediately start with direct pressure. There are a lot of wounds, that venous bleeding wounds, that can be dealt with by simple direct pressure. But if it's arterial, if you see blood spurting out in a way that mimics the pulse of a person, you've got an arterial vessel that's going on. And what you need to do then is you need to immediately put on a tourniquet. Matter of fact, the Committee on Tactical Combat Casualty Care says that should be your first course of action if it's obvious that the bleeding is heavy. And so that is what I also suggest in articles in our books, that you always have a tourniquet available, and that it is the first thing you do if you know you're dealing with some severe bleeding. And you want to, of course, be able to expose the bleeding, the area, to make sure that you know where people are bleeding, because a gunshot wound is going to have an entry wound. It could just as easily have an exit wound, and the exit wound may not be where you think. If I approached you, Jester, and you're armed, I approach you bent over, crouched over, and heading towards you with, I don't know, a spear or something like that, and you shoot me in the collarbone area, okay, or in the trapezius muscle area up here. My exit wound might be out my buttocks.
Right.
So there's also, you have to look all around as fast as you can while continuing to try to control the bleeding. You try to make sure you get a handle on where the bleeding is, because the bleeding could be coming more from the exit wound than the entry wound, since they're oftentimes larger. So that's something. So you want to use. Go ahead.
Two things I'd like to throw out real quick is, it's funny that you bring up the entry wound and the exit wound, because like right now as an EMT, we're not allowed to document and say entrance wound, exit wound. We just say there was a hole here, there was a hole there. We're not allowed to put that in there anymore because it's so unpredictable. And then the other thing I wanted to throw in here too, and this is something we just covered in class, was different types of clothing like Gore-Tex or spandex or something to this nature can actually prevent blood from exiting the clothing. So, doing this full body scan, doing this full body check for, the exit wounds or different areas of bleed are very important, because you might get that tourniquet on one area, not realizing they're bleeding out from somewhere else.
You're absolutely right. Now, if the bleeding's in an extremity, you can apply, one of the typical limb tourniquets, like the cat tourniquet, the SWAT tourniquet, the soft T, if bleeding is a big issue. So you want to use that immediately. And if that fails to stop the bleeding, number one, the likelihood is that because you're worried that you're hurting the person, you're not putting it tight enough. So that's number one.
Right. You have to hurt people to save them.
If it doesn't hurt, you're doing it wrong.
Right. Tons of pressure to the point where they're screaming.
Right. If they're still bleeding, then you put a second tourniquet on a couple inches higher up. Or if you don't know where the bleeding is for sure, then I want you to place the tourniquet high and tight. When I mean high and tight, I mean way up there, at the top of the leg, way up by the armpit, if it's in the arm. So high and tight's the way it goes. Now, if you are in a situation where there have been a gunshot wound and you are not sure that the threat has been abolished, okay, ordinarily I tell people to get out your bandage scissors from your bleeding kit and cut through the clothing. But if you're under fire, forget about that. You put everything over the clothing. And not a lot of people know that that's the appropriate way to do it with the medic under fire.
Do you have enough food in your pantry for when disaster strikes? Go to www.readywise.com and utilize code DOOM10 for 10% off your entire food order. ReadyWise offers long-term food storage items such as chicken and beef that last up to 15 years. But that's not all. Go to www.readywise.com and use our code DOOM10 for 10% off of organic food as well. Offering chili, pasta, and soups, they have you covered. Did we mention they have fruits? Bananas, blueberries, strawberries, and apples, just to name a few. With many more food options for your home, car, or bug-out bag, ReadyWise has your six. Go to www.readywise.com now and utilize code DOOM10 for 10% off.
So of course, now another thing that I'd want people to have besides the tourniquet is I want them to have some hemostatic gauze. Now this stuff is not cheap, but it will indeed stop bleeding, even arterial bleeding, if you place it, pack it in, apply pressure for a good 3 minutes. Now, I'll tell you a story that one of the Navy buyers for some of these medical supplies told me, and that he took some of this Celox, which is a chitosan type of blood clotter. And what they did a test, and what they did is they shot with I forget the round, but they shot the femoral artery of a pig. They strung up a pig, shot the femoral artery, and then they applied the dressing, the chitosan dressing. Applied it for 3 minutes, stopped the bleeding. Then they shot the other femoral artery, took out the dressing from the first place, they put it in the second place and stopped the bleeding too. So this is, if you have a real serious bleed, then you need to have some of these hemostatic dressings in your supplies. And Quick Clot is one. Chitosam is one made by the guys that make the SAM splints. Celox is another. That's a British-made company. A British company makes that, and there are a number of other brands nowadays. But these are the types: the chitosan and the kaolin, which is what's in Quick Clot, are the ones that are approved by the Committee on Tactical Combat Casualty Care. And so you want to apply that directly on the blood vessel. And if this is important. If you had put plain dressings first, or plain bandages first, I want you to take those out and then apply the hemostatic dressing directly on where the bleeding goes. It has to go directly where the bleeding goes. And that's usually if it's a big wound, but it's close, probably coming from the part of it that's closest to the torso. So that's where I want that to go. Now, if you don't have blood clotting dressings, then what I want you to do is just continue to pack, and don't take that old dressing out. I want you to just continue to pack these non-clotting dressings one on top of another into that wound.
Right, because, I mean, back in the day before, the bleed stop powders and these different bandages and dressings, they would always teach, keep applying, don't take it off, keep applying, because it's, refresh my memory on this, it's the hemoglobin in your blood that creates the clotting properties, right?
Right, well, it's the hemoglobin, but it also forms a protein called fibrin. And the fibrin forms a mesh, which begins the clotting process.
Okay, yeah. So back in the day, they would teach you just keep adding bandages. You'll clot on your own. But the big thing people are not thinking about nowadays is that there's a lot of people that are on medications that prevent clotting, right? So
Yes.
if you're on, say, like a blood thinner or something like this, or something that prevents blood clots, this person, it's going to be a lot harder to stop their bleeding. So that's where some of these would really come in handy. And I have to ask, what's your opinion on the bleed stop powders, the ones you actually, open up and pour into the wound?
Well, I think that the current ones that are being used for these for these situations usually are powder or granule impregnated gauze, and so it's gauze, and it's something that is probably better to use these days than what they used to use in the past.
Okay, I understand. So guys, just to shorten and wrap that up, bleeding's very important. There's a lot of tools out there. I guess they got to get the book, right? You got to get the book.
Well, I'll tell you, we do have a lot of step by step instructions of how to deal with a lot of different things. We talk about how to even do tracheostomies step by step, how to even do an amputation if you had to. Now, I mean, I'm telling you these things because I wanted to make sure that I was complete in terms of giving you instructions on what to do. That doesn't mean that I think that there's going to be that the people that you're going to do amputations on are going to have a great percentage survival rate, but it will be more than 0%.
Something that's not on the list to ask you, but I got to ask anyway, just because we talk about survival, things like that. One thing we've been covering in class, and they kind of keep giving us the roundabout for treatment, is venomous bites, things from, venomous snakes, venomous spiders. Are these covered in the book? And if so, is there a good method of treatment? I know for a lot of these things, everybody thinks, they administer anti-venom. But I know typically in an ER setting, they're giving you blood pressure meds and, ibuprofen, things like that. So survival scenario, rattlesnake bite, what, treatment options?
Fire is one of the most basic essentials for survival. Whether you're camping, hiking, or preparing for disaster, Blackbeard has your six. Go to www.blackbeardfire.com and utilize code DoomsDay for 10% off your entire purchase. Blackbeard offers stormproof matches, plasma arc lighters, fire starters, and ferro rods, all of which are great for your bug out bag. Once again, go to www.blackbeardfire.com and utilize code DoomsDay for 10% off your entire purchase.
Well, rattlesnake bite, basically, the thing that you need to know is that about 30% of rattlesnake bites and other pit viper bites are going to be dry. And that means that they're not going to have venom in it. So that you're not always necessarily going to experience an envenomation if you're bitten by a rattlesnake. Now, if you do, symptoms are going to begin very soon after the event. About 35% are mild reactions, maybe 25%. Moderate, 10 to 15% are severe. And those are the ones that you'd want to give antivenom for. Believe it or not, you probably would do okay over the course of time if there was no antivenom available for the mild and the moderate reactions. So that's something that I think is important. Now, if you're going to have a venom in there, it's going to be pretty apparent, probably within maybe 5 minutes or so, there's going to be burning in that area if it's a pit viper. So that's something that you have to realize, that it depends on the species of snake a little bit, how much venom was injected, the age of the victim. That's important. The elderly and the very young people are the most at risk of having problems. You're going to see things like burning pain, but the pit vipers are hemotoxic, so they're going to cause some bleeding. So bruising, you'll see bruising on the skin, you'll see swelling, may affect the entire limb. There may be blisters that are blood filled. These are some of the things that you would actually see. Now, these are circumstances where you probably will just want to have people off their feet. Everybody's a little different as to where they recommend that you put the limb, whether it should be at the level of the heart, below the level of the heart. In some circumstances, people say above the level of the heart. Believe it or not, there's actually controversy with regards to that. But I say at the level of the heart or below the level of the heart. That's what the Merck manual says, and that's what a number of other pretty authoritative sources say that you should be doing with regards to that. And usually people will get better on their own as long as they're not moving much. You don't want them to do a lot of movement, because that will increase the speed of the circulation of the toxin into the system.
Okay, yeah, because I know that's like a big thing, is preventing this venom from moving through the body. And I know everybody thought back in the day you'd tie it off, you'd put a tourniquet on. Now we're learning no,
definitely not use.
Do not
use a tourniquet. Absolutely not. And I really don't even want you to use a base wrap on it, or at least certainly not with any type of pressure. So these are things that in most cases, you're a young, healthy person, you're going to survive this envenomation.
Right, and then there's also the big myth about sucking out the venom.
Yeah, don't do that. Don't do that. And I also there's a myth about this item called the Sawyer extractor too. You know that the Sawyer extractor is a item that was meant to be in every medical kit, had one back a few decades ago, but they found that by the time you actually get the Sawyer extractor out of your pack and put it on the wound and actually start using it, that the grand majority, probably 90-something% of the venom has already gotten into the bloodstream.
Right. Yeah, it's amazing. So how you brought up there was like some controversy with some stuff. Guys, there's a ton of controversy in the medical field. They're always going back and forth. Right now, my instructors are telling me they want to see C-collars done away with because they don't feel that they're doing any good for anybody. And I gotta tell you, I had one of these things put on me in training. It hyperextends your neck so much, I feel like you would do more damage to a patient applying this.
Right, especially if they've had an injury to the C-spine. It's really hard to justify the use of some of these, at least in the hands of people that don't have a great deal of experience with them. And also, if you are a medic under fire, and I write a lot about this stuff. People, medics in hostile action. Matter of fact, I just put up an article on it on the website doomandbloom.net. You actually do not do in the field, or at least in a hostile situation, you do not worry about spine or C-spine, because the reason that your men are going to bleed, are going to die, is they're going to bleed out.
Right. Yeah, I guess typically people don't bleed out from a broken neck or a C-spine injury.
Right. And so if somebody has a broken neck, there may not be much you can do for them anyhow. It depends on the situation, of course. And certainly in the situations that I write about, where, in other words, where there is no hospital that this guy's going to, there's no TACAVAC, no medevac, it's you from beginning to end, determining whether this person will survive or not. If you're dealing with somebody with a broken neck with limited supplies, and your base camp is a tent, hospital tent, that person is probably not going to make it. And this is the sad thing, is that it's the reality of some of this stuff is, is sad. In other words, if you get if somebody shoots you in the chest or shoots one of your people in the chest, that person has got about a 70% chance they're going to die. If somebody gets shot in the stomach, it's going to be about 60-something%. And unless you can get in there and, and do an open up the belly and start sewing things together, and you're not going to be able to do that before the person bleeds out.
Right. And, just for everybody out there, I mean, everybody that listens to the show is a prepper. You guys do understand, as much as you do prepare, certain situations are just unmanageable, right? And,
right.
The idea of preparing, the idea of having this knowledge is to increase your chances of survival, not guarantee them.
Are you looking for something kick-ass to add to your closet? Reaper has the hookup for t-shirts, hoodies, button-ups, hats, beanies, and plenty of other badass products. You can check out Reaper Apparel Company at www.reaperapparelco.com and use code DOOM10 for 10% off. Jester only stands behind brands he believes in, and Dan at Reaper Apparel has a mission, and Jester is on board. Go check out www.reaperapparelco.com today and use code DOOM10 for 10% off your entire order. Why be a sheep when you can reap? Use code DOOM10 for 10% off at www.reaperapparelco.com today.
Yeah, that's basically it. Basically, I follow that old saying of Teddy Roosevelt. And that saying goes, do what you can with what you have where you are. And that's what I'm doing, is I'm basically telling you what you should have, telling you what you should do so that you can do what you can, and you have to do it where you are. In other words, in a non-hospital setting. And so the entire book is like that. And that's different from a lot of other books. There are a lot of great first aid books, but of course, they always tell you at the end of the chapter, go to the hospital or go see the doctor. And even books like Where There Is No Doctor actually end a lot of their chapters like that. But in our book, between the first page, the cover page, and the back cover page, you'll never see me say that, because the entire book assumes they no longer exist.
I totally 100% understand, because that's the big reason to prepare, because these services aren't going to be available. There's not going to be an emergency room to go to.
You're absolutely right. You're the emergency room. You are the emergency room, Jester. And so the fact that you're actually undergoing some medical training now basically makes you worth your weight in gold.
I would like to think so. So, Dr. Alton, I got two more things I'd like to bring up before we run out of time here. So, number one is, for anybody that has no medical knowledge and they're just about to get into this and get started, what would you suggest? What would their jump off point be?
Want to be a guest on the show? Email it's doomsdaypodcast@gmail.com. That's it's doomsdaypodcast@gmail.com.
My book, our book. Basically, I mean, I tell you from soup to nuts. I tell you, I hate to, you're that's a loaded question, because you're putting me right to where I want to answer this question, saying it's my book, because it's true. It's all in plain English. If you read it at 5th grade level, you'll still understand everything that is in this book. I mean, I will talk about how to do a physical exam, how to do vital signs, how to take a blood pressure. Hell, I'll tell you everything from hemorrhoids to hepatitis. I'll tell you everything from allergies to amputations, and it will all be in English that you will understand. And I'll also tell you, Nurse Amy basically tells you a lot about how to take care of how to nurse a person back to health once they've gotten the injury and once you've done your first aid for it. I mean, remember, the difference is that you're no longer being able to just stabilize the patient and transport them to the next highest resource. You are the highest resource. So if somebody breaks a leg, you got to take care of that injury from beginning to end. But absolutely from beginning to end, that person is going to be seeing you. You're going to determine whether you're going to put a cast on, which you can buy those materials too, whether you should just need a splint, whether how they're going to function in terms of while they're healing, and whether they heal at all in the end is going to be determined by you. And you're doing it from beginning to end. So, we tell you what supplies you're going to need. We tell you all the different things that possibly could happen. I even go through, we have a huge section on dental issues. And I'll tell you something, that if it's a storm that knocks out your power for a week, you probably don't need to know much about dental issues in survival settings. But that problem, if you're off the grid for 6 months or more, your dental equipment, your dental knowledge is going to be as important as your medical knowledge. And so we even tell you how to extract a tooth, what to do with a tooth that's been knocked out, with a broken tooth. We really go through everything, and we tell you the exact materials that you need. And we actually produce a lot of these materials ourselves at our store at doomandbloom.net. But you can get these materials anywhere if you can find it, although some of our kits are one of a kind.
Now, Dr. Alton, one more time before we're out of here, what is the name of the book and where can they find it?
The book is called The Survival Medicine Handbook, The Essential Guide for When Help is Not on the Way. It is in its 4th edition. Don't get earlier editions. You'll still see some for sale on Amazon. Get this one. This one has been expanded and revised. It used to be a 6x9 book. It's now an 8x10 book that's 700 pages. And it's got so much material in there that you can spend a year probably going through it and absorbing a lot of knowledge. And once you do that, you'll know what materials you need. You'll know what other kinds of items would be useful. You'll know what to do in natural disasters to increase your chances of surviving them. And we just go through an awful lot of stuff. You will not be sorry.
This is an emergency action message. At approximately 1 a.m. Eastern Daylight Time, NORAD is tracking 15 ICBM nuclear missiles inbound to the following cities: Orlando, Miami, Pittsburgh, Dover, Newark, Richland, Philadelphia, New York City, Baltimore, Los Angeles, Las Vegas, Boston, Seattle, Detroit. This is an extremely deadly situation. Stay tuned. The next emergency message will be a presidential address.